Gingivitis. Gingivitis is the inflammation of gingiva. These are the parts of gingiva. There are 4 stages in gingival inflammation. Stage 1 is initial lesion. Stage 2 is early lesion. Stage 3 is established lesion. And stage 4 is advanced lesion. Before we learn into the stages of gingival inflammation, first we need to know about the pristine gingiva. Pristine gingiva is a normal gingiva that is free from significant accumulation of inflammatory cells. It is histologically described as pristine gingiva or state of super health. First stage is initial lesion. It occurs 2 to 4 days of plaque accumulation. This is plaque. Here, the widening of small capillaries and venues are seen. Within 1 week, neutrophils marginate into the connective tissue by means of diapedesis. Diapedesis is the process by which neutrophils come in contact with the walls of blood vessels and squeeze through the walls, then thrown into connective tissue. There is increased number of neutrophils seen in the connective tissue than healthy gingiva. Here, lymphocytes are also seen in gingival sulcus in response to plaque. Next, stage 2, that is early lesion. It occurs 4 to 7 days of onset of plaque accumulation. Here, multiplication of capillaries seen. There are more capillaries than stage 1. Increased neutrophils seen in the connective tissue, and erythema occurs due to the multiplication of capillaries. In this stage, bleeding on probing is positive, and these neutrophils travel to epithelium by chemotaxis in response to plaque components, and it destroys bacteria. More than 70% of collagen are destroyed by bacterial enzymes and also by matrix metalloproteinase enzyme released from leukocytes. Junctional epithelium is densely infiltrated with neutrophils, that is more than 75% of T cells and other cells, mainly macrophages, plasma cells and mast cells. Here the reti ridges invade into connective tissue. Next, stage 3, which is established lesion. It occurs within 14 to 21 days of onset. Here there is small gingival pocket seen, which is lined by pocket epithelium. The color of gingiva becomes bluish red. Engorged blood vessels and impaired venous return leads to sluggish blood flow, and RBCs are extravasated into connective tissue. It breaks down and release of hemoglobin seen. Again, reti ridges invade into connective tissue. In this stage, there is predominance of plasma cells and B lymphocytes seen. The collagen is further breakdown by collagenase, which is released by some bacteria and neutrophils. In stage 3, there is increased activity of enzymes like increased acid phosphatase and alkaline phosphatase activity, beta glucuronidase, increased beta glucosidase, increased beta galactosidase, increased esterase, increased aminopeptidase, increased cytochrome oxidase, and decreased neutral mucopolysaccharide levels. Next, stage 4, which is advanced lesion. Gingivitis will progress to periodontitis only in susceptible individuals. Here, the continuous loss of collagen subjacent to pocket epithelium is seen. Junctional epithelium migrates more apically from cemento-enamel junction. Alveolar bone loss seen is due to the increased permeability of connective tissue and the inflammation extends into the bone. Plasma cells predominate in connective tissue and neutrophils predominate in epithelium. Here is the summary.